Hello, everyone. This is Iman from Altaram Institute. Thank you for joining. I greatly apologize for this morning's technical issues with the recording and with the live webinar. In lieu of that, I'll be walking through the presentation, walking through the demo, and I will have my information at the end of the presentation available to you so you can reach out with any questions, any concerns, and you can email or call us. So I'm going to be talking about Michigan's Dental Registry. Michigan's Dental Registry was built to enable the communication and coordination between the medical and dental providers, allowing for improved oral health access and care quality for patients on Medicaid. This is our CMS notice. We are funded through a grant through the Centers for Medicare and Medicaid Services, and we're funded as part of a Healthcare Innovation Award. A little bit about Altaram. We're a Michigan company established in 1946. We are headquartered here in Ann Arbor, Michigan, and we're focused specifically on health and healthcare. A lot of our work is with the University of Michigan as well as with the state of Michigan. And we really work to build system-based solutions to problems in healthcare with the goal of reducing costs, improving quality, and improving access. As I mentioned, this is a Healthcare Innovation Award. The goal of the award was to reduce the burden of oral health disease for children in Michigan. Target population is those 1 million Michigan children insured by Medicaid and CHIP. We are funded for 3 years, now over 3 years. We started in September 2014, and originally the end date was August 2017, but we did receive a no-cost extension to continue through to February. The application I'll be talking about today, Michigan's Dental Registry, is funded beyond that, and we expect that to stay open because we've got some supplementary funding from different sources. So our partners on this are the Delta Dental of Michigan, the Michigan Department of Health and Human Services, their Oral Health Division, and the University of Michigan School of Dentistry. Our goal is it's pretty obvious to reduce childhood dental disease. It's the most prevalent chronic condition among children in the U.S., but it's mostly preventable. And so our intervention aims to prevent the decay from happening, and it's three-pronged. Our first is to educate and activate those medical providers. We've trained over 1,500 medical providers to integrate oral health services into the care setting, providing children during those well-child visits with oral health services such as fluoride varnish and oral screenings, and recommending that those children go to see the dentist. We built an enabling public health infrastructure, and that's MIDR. That's what we'll be talking about today, to allow those physicians who are providing those preventive oral health services to then place the referral directly to a dentist who is accepting and will see children on Medicaid. And lastly, we are working to educate and activate those schools and WIC clinics. We built a tool called SmileConnect.com, SmileConnect Community, that allows community centers and schools to place requests for supplies and oral health education. And in dental schools, those dental students, dental hygiene students, and dentists can volunteer to provide those services. We've got philanthropic organizations that are donating supplies. And that way we're providing care, oral health care, in alternative settings and making sure that it gets to the children who need it. As we're scaling this application, this solution outside of Michigan, we are rebranding the Michigan Caries Prevention Program to be called SmileConnect, and the different solutions such as the training, the medical providers is SmileConnect CME, MIDR in other states is SmileConnect Clinical, and SmileConnect Community is that application that can be used to place requests for services. So what is Michigan's Dental Registry? Michigan's Dental Registry is a clinical application that is used in a clinical setting to place referrals directly to dentists, and allows those medical and dental providers to communicate electronically in a secure way. It's built for medical, dental, and social service providers. We've also got foster care health liaison officers using the application. We're working with the WIC groups. We're working with your organizations to ensure that everybody has this resource to place referrals to dentists, and has a resource to be able to communicate regarding their patient's oral health. We're also a meaningful use specialized registry which means that the data from the clinical application feeds into a database, and then medical and dental providers who attest to use the registry for meaningful use submit additional data on their rates of fluoride varnish, rates of oral screenings, rates of dental decay, and it allows us to have a population level access to the information, understanding, how we're doing in regards to oral health access in Michigan. I'm going to go ahead and jump into the demo. So what I'm going to do is log in. So as you can see, this is my login for third party. Many of you already have access to this application. Medical and dental providers across Michigan have access to this. So MIDR itself is accessible behind this firewall. It allows us to provide secure access to these providers to the application. So I'm going to walk through how a medical provider would use this application, place that referral to the dentist, and then how the dentist can look up that referral. Sometimes our connection is not very great, so it slows down. So what I'm going to do first is select the organization I'm practicing from. So I'm going to say Clinic B. And then I could either search using a Medicaid ID, or if I've got a patient saved already to my patients, I can pull them up from there. If I search using a Medicaid ID, our system will pull that patient up. If you search for a Medicaid ID that is not in our system, you'll be prompted to add information about that patient. So we'll do that. You can see here, they add patient, and then we can enter the patient's first name, last name, their date of birth, their sex, a primary phone number, and an alternative phone number if there's more than one. We can flag if the patient's in foster care or if they have special needs, and then we can add that patient directly to my patients, and that's this section over here. So I'm going to pull a patient from here. Okay. So as you can see, this patient has 3 referrals, one that's been completed. So the dentist came in and said that the patient was seen. And I've got 2 other referrals, one that the referral was seen, and I'm assuming the dentist is following up on, and the other one, nothing's happened yet. There's 2 main sections to the application. There's the treatment section and then the referral. So our system, so here I'll indicate whether I applied fluoride varnish or if the patient said no, or if it was not indicated, say the patient didn't have teeth, or as you can see here, they're up to date on their fluoride varnish. I can document care for a previous date or a future date. So this can be updated later. It doesn't have to be updated real time. So I'll say it's not indicated fluoride varnish. And then I did do an oral screening and I saw obvious decay. If these labels here are pulled from the AAP risk assessment, so if a physician doesn't know what they mean, they can click on this link for that resource. And we scroll to the last page. There's pictures alongside the labels, so you can see sort of what you see in the mouth and what you can expect, how you can sort of diagnose it. And you can say that the patient isn't brushing regularly, and so that's the behavior that we're concerned about. So we'll save, and everything we do is saved here in the treatment information. There's my name, the type of user, the date of the care, and what I did. Then we'll go to the dentist search and referral because, we saw obvious decay. We think the patient needs restorative care. And referral notes, we can say patient is complaining from pain. And that can kind of increase the urgency. The dentist sees that and they know the patient needs to be seen sooner rather than later. It may be an infection or something. And then we'll search for a dentist in our area. This dentist search here actually accesses the Delta Dental of Michigan dental provider database directly, which means it has the latest information on every dentist, their address, their phone number, whether they're accepting new patients. Delta Dental collects additional information, as you can see here, if the dentist is within public transit access, if they treat special needs, if they're handicap accessible. And then we flag dentists if they're MIDR users. So if you search for a dentist in your area, what we're doing is we're going to check and see which of those dentists have an account with our application, and then we pull up those patients to the top of the list, or those dentists to the top of the list. There's additional information about each of these dentists, which you can find by clicking here, the languages they speak, their hours of availability, and email if you're interested in reaching out to them, their phone number and fax number. So we'll go ahead and select this dentist and send a referral. If you select print PDF, we're going to generate that PDF and you can print it and process it yourself. If you select send fax, we will send the fax directly to the dental office. And then what we do is we actually run a check every night to make sure that those faxes were successful in going through. So if we have any issues, for example, the dental clinic had that fax was, their fax machine was turned off or down or out of paper, we can make sure they still receive that referral. So the fax that is actually sent does not contain any PHI, and that's in the interest of course, protecting the patient information. We want to make sure that we're not always sure where the dentist might have placed the fax machine, whether it is in a secure location. So in order to prevent any issues with that, we make sure to just send a generic letter that the most important part is that referral ID that can be used to look up this dentist. Also, if the dentist has an account with us, that referral will also show up on their homepage, and I'll show you how that looks. There's also a referral summary that can be printed and given to the patient. It's got information on the dentist that was referred to, the notes that were provided, and the latest care this patient received. So I'm going to go ahead and log out, and I'm going to log in as a dentist through the same system. I'm going to look up that referral that we just placed. I'll launch the application. Okay. Some dental dreams today. Submit. Now, as you can see, I've got the same My Patients section as a physician has access to. And then the referrals placed to your clinic show up here. Now, I didn't place a referral to either of these clinics that the dentist has access to, so I'm going to search directly for that referral that we just placed. Okay. So I'm going to add this patient to My Patients so I have access to him later. And then the first thing I see is that referral that was placed to me. Automatically, our system is going to mark this patient as referral seen because I looked up their referral. But I'm going to go ahead and say I accepted the referral and save. So that way the physician knows I'm following up, and I'm going to reach out to this family and schedule that appointment. What I can do, so now I'm going to see the patient. I've seen the patient, and I said the fluoride varnish is not indicated. Yes, there is obvious decay and restoration fillings present. And then what I did was I provided preventive care and diagnostic care, scheduled patient for follow-up visit. So that's probably when I'll do the restorative care. I'll save. Now at this point, the patient was seen, so I'm going to say that I've seen him. This is a future time. And as you can see, that referral gets moved into the completed section. So you can see this patient has received 4 referrals, which is not common. Most patients receive 1 to 2 referrals because really the physician wants to establish a dental home, and that's the priority. But in this case, because we're in our test system, we get more than one. We'll place more than 1 referral for patients to test different features. So now, as a dentist, if I would like to place a referral to a specific specialty that is accepting Medicaid, this application is very useful for that as well. If you're looking for an oral surgeon or you're looking for a pediatric dentist, you say this patient needs, to be provided with care under sedation. That can be done. That referral can be placed through here. The dentist will receive the referral the exact same way, and they can update the patient's record the exact same way we just did now. So not only does this allow coordination across settings, but within the dental provider community, it allows for coordination. So turning to the application, So just to give you a little feedback and information on what's being done within the application, most referrals are being placed for preventive care, which is what we would expect. Many physicians don't feel comfortable diagnosing or indicating specifically what kind of care a patient should receive. And a lot of them are interested in just finally establishing that dental home for the patient. And then the type of dental treatment that's being provided is really that preventive and diagnostic care, as we could expect, because the dentist is often first trying to identify what's going on and trying to build a treatment plan. And we see that in the notes that the dentist is providing as well. We're seeing that, I've scheduled them for a follow-up visit, or we're actually scheduling them at the OR for treatment under sedation, or, they need multiple crowns, and I'm following up on that. So it's really along the lines of what we would expect, and we would hope that that relationship continues on with the dentist and the patient. So before I actually continue, I want to show you quickly how you would create an account. And as I mentioned earlier, you can always reach out to us directly, and we'll walk you through this process. But if you have a MyLogin account currently, you can request access to the application the same way you request access to any other application. You can search for MIDR, M-I-D-R, or we are under the Michigan Department of Health and Human Services. And then once you get that application on your home page, the first time you click on the application, you'll get something like this. You'll go ahead and get started. And you're going to say medical, the type of care you provide. And then, for example, if you're a registered nurse, you'll select that. And then from select your organization, you'll select maternal infant health program. And that'll be here. It's not in our test site, but it's in our production. So this is what it'll look like. For example, you click here, you'll see the address, phone number. You don't have to put in your specific information yet. What you'll do is you'll submit, agree to the user agreement, and then if you get automatically approved, you'll have access to the application. If you don't, we'll process that for you and let you know once it's okay for you to use the application. And then what will happen after that is when you go into the application, you'll be able to add your specific location. So the first time you go in, you're just going to see maternal infant health program here. Oh, like right there, actually. And then you can come here and press add an organization. What you'll do is add an organization and put in your specific location. And key here is to add that contact information that's important for the dentist to know. So if your name is, Wayne County Health Department or anything like that, and then the street address, city, your email, a phone number, and a fax number that they can reach you at. And that's really the important piece of it, because the next time you'll come in, you'll actually select that organization from the dropdown, and you'll provide the care as a provider of that organization. And as I said, we can walk you through this process. It takes about 10 minutes, so we can do that anytime. If you have any other questions or any feedback on how we can improve this application or how you think we can make it easier to use, please feel free to reach out to us. You can email me directly. You can call me, or you can email us at midr@altarm.org as well. We look forward to hearing from you. Again, thank you so much for your patience with our issues this morning, and I look forward to hearing from all of you. Thank you.